Public health officials in London, Ontario, say they've identified the likely source of a deadly outbreak of Legionnaires' disease.
Now that a likely source has been identified, all efforts are being taken by ourselves and the operator to remediate the system and to prevent ongoing transmission.
The operator, Sofina Foods, a meat processing plant in the east end of the city. Officials say they've linked the outbreak to that plant. The outbreak was declared initially back in July and then declared over earlier this month. Then 25 more cases emerged, and now the numbers are up to at least 94 people having been infected. 4 have died, and there are hospitalizations as well. The company issuing a statement saying it's committed to the health and safety of its employees and to the community, and it will continue to work with London health officials. Our previous CBC News reporting has talked about how cooperative the company has been, but it has now been identified as the likely source of this deadly outbreak. It's an interesting story, and Dr. Christopher Labos interested in it. He's back for a bonus visit with us this week, epidemiologist and cardiologist, and he's in Montreal this morning. Hi, Dr. Labos.
Hello, hello.
Legionnaire's disease. Let's talk about that so we understand exactly what we're dealing with. What is it exactly?
So it's a bacterial infection that often causes a pneumonia, sometimes very mild, sometimes very severe. It's caused by the Legionella bacteria, and it gets its name from where it was first discovered. The first big outbreak was at a meeting of the American Legion back in 1976. So all the attendees of the conference got sick because of a contaminated air conditioning unit at the hotel where the conference was being held. And so because it was at the American Legion, it became known as Legionnaire's disease, and the bacteria that causes it called Legionella.
And how does it, that's a really interesting story. How does a person become infected?
It almost invariably is because of a contaminated air conditioning or air cooling or HVAC system or what have you. This bacteria tends to live in the soil and tends to live in the water, so you can, in theory, get contaminated from what's called environmental exposure. But invariably, whenever you have especially a large outbreak like this, it's because water that we use in air conditioning systems is contaminated. It gets into the system, the bacteria colonizes that system, and then the air conditioning system is spraying out little sprays, little aerosols that are contaminated with the bacteria, and the people attending the conference, hotel, spa, whatever building it's in, end up breathing in these aerosols and getting the bacteria into their lungs, which is what makes them sick.
That's interesting. In this case, a meat processing plant. Why this is important development, it seems to me, is to be able to pinpoint the source, because in London they were looking at 9 different cooling towers and a radius of cases within about 6 kilometers, and they weren't able to pin it down. But now they have with this meat processing plant. Is that a sort of a key moment in the trajectory of this outbreak?
Right, it is, because unless you decontaminate the air conditioning system or the water cooling tower or wherever the bacteria is, people are going to keep getting sick. And I see you saw that in the report, right, where they had an outbreak, it seemed to be getting better, but then more people kept getting sick. So unless you get rid of the source, more and more people are going to keep getting infected as they are exposed to, the contaminated water aerosols coming from the cooling tower.
The health unit spokespeople were talking about how they do expect to see more cases still presenting. So let's look to all of this. What are the symptoms that people should watch for if they potentially were contaminated?
So some people will be fine, as it is with all things, right? Some people are exposed and don't develop any type of illness. Some people get a very, very mild fever, which is often referred to as Pontiac fever. And then some people get a pneumonia, and that's what tends to land people in hospital, and that's what makes people very sick and contributes to deaths. You're not going to be able to know if that pneumonia is being caused by Legionella or some other bacteria. And in fact, as a healthcare practitioner, you won't know if it's caused by Legionella or some other bacteria unless you specifically test for it. And that's sort of the important medical point here, is that when you see a large number of people getting sick, especially if there's an outbreak, you have to specifically test for Legionella so that you can specifically treat the Legionella.
And respond quickly, I would imagine, because things can advance, and we've seen deadly potential here, 4 cases of deaths in the London outbreak. What is the treatment available if someone is confirmed to have this?
It's antibiotics, right? Fundamentally, as much as this has been a terrible outbreak, this is still a bacterial infection. It responds to antibiotics. You just have to treat the appropriate antibiotics like azithromycin or some other fluoroquinolone. It is treatable and people tend to respond very quickly. The good thing about bacterial infections is that once you start on antibiotics, people tend to turn around very, very quick. Obviously, there are more severe cases and people who are immunocompromised tend to do worse. That is one of the major risk factors for this. But if you can start people on antibiotic therapy and the appropriate antibiotic therapy, there's every reason to believe that most people would recover and recover quite quickly.
Thank you, Dr. Labos. I really appreciate this as we continue to follow what's going on in southwestern Ontario. Dr. Christopher Labos on CBC Morning Live.